Namaste Betiya, हमेशा खुश रहो बेटिया. A very good morning to all. Myself, JVWU Ravi, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at JVWU Women's University, Jain. In today's clinical lecture, we are going to discuss about abdominal examination. Whenever a patient is coming to us with some sort of gastric complaints or the complaints which are related to your abdomen, then it is very essential to perform an abdominal examination in such patients. We have already studied, and I believe that you already know that what are the different organs that are covered under abdomen section. Alright? So there are various organ systems that are present in the abdomen. And if there is any pathology that is related to your abdominal system or abdominal organs, then a patient is coming to us, and then we have to perform the abdominal examination. Whenever any patient is coming to us, the whole examination is divided into two parts. Number one is the general physical examination, and the second one is the specific examination. In general physical examination, I have already discussed with you that what are the various things that are to be seen from head to toe. We have to look at the physique, the appearance of the patient. We have to look at the physique of the patient. We have to look from head to toe, from the head, eyes, ear, nose, mouth, tongue. Alright. Then we have to check for the cervical lymphadenopathy. We have to check for the axillary lymphadenopathy. We have to check for any other abnormality. We have to look for the scar marks. We have to check for the vitals. We have discussed about 4 different vitals that we need to check about. That is temperature, pulse, blood pressure, and respiratory rate. So we have to check for the extremities. We have to check for the presence of any kind of anemia, pallor, alright, jaundice, icterus, any kind of swelling. All these things we have to check about. This is covered under the general examination of the patient. Then, after doing the general examination, we will come to the specific examination. And as we are talking about abdominal examination, we are going to discuss now about the specific examination of the abdomen. So now we will start with the abdominal examination. Whenever we are doing any systemic examination, usually there are 4 steps in doing the systemic examination. Number 1, we have inspection. Where in inspection we are just looking at the patient. We are not touching the patient, but just by looking at the patient, just by observing, we are coming to a certain conclusion. So the first step in any of the systemic examination is the inspection. Next is palpation. The second point of examination of the patient is palpation. Palpation is used by using the fingers. We are using our fingers to palpate, alright? Palpate the patient, and in this way we are doing palpation for checking out the if there is any kind of tenderness, any muscle guarding, muscle rigidity. All these things are checked for during the palpation. Alright. So first we had inspection, then we have palpation. The third step in doing any kind of examination is the percussion. During percussion, we are tapping. We are tapping on the patient. We are using these in this way. We are using this middle finger and this hand. We are putting this on the surface and then tapping on the patient's surface, on the patient's body surface, in order to listen different kind of sounds. The sounds are basically in abdominal examination. There are 2 types of sound that are heard. Number 1 is the resonant sound, and the second one is the dull sound. Resonant sound is basically related to the air. Wherever the air is filled, we will see the resonant sound. And when there is fluid or any solid structure, then dull sound will be heard during the percussion. In percussion, we are usually in abdominal system. We are using this percussion methods for a number of things. but especially in case of ascites, this is very useful method. So we have done first of all seen the patient during inspection, then we have done the palpation. In palpation we are doing the light touch to the patient, then we are doing percussion. In percussion we are percussing over the different surfaces, different areas. We are looking for the resonant sound and the dull sound. The fourth step of examination is the auscultation. During auscultation, we are using the stethoscope to listen for different types of sounds in the patient. So, auscultation is done by using a stethoscope. So, these are the four basic points which are used or which are followed while doing the systemic examination of a patient. So, in the abdominal examination, we are going to discuss these points one by one. Now, first of all, we will start with the inspection. Whenever we are going to the patient or whenever a patient is coming to us, how are we going to inspect the patient? What are the various things that we are going to look in a patient who is coming to us with the abdominal complaints? Alright, so during inspiration, we are looking at the following things. Alright, first of all, we are looking at the skin. What are the various things that we are going to look at the skin? First of all, while doing the examination of the patient, you have to follow a set procedure that I am going to discuss with you now. You have to ask the patient to lie down supine, alright, on the bed, examination table, and then care has to be taken that the hands are along the side, the head is slightly elevated by 1 or 2 pillows in order to relax the abdomen. Alright. You can also ask the patient to flex the knees in order to relax the abdominal muscles. Alright. But for inspection, we just have to ask the patient to lie supine and with the head slightly raised by using the pillow, and then we are going to see the patient or inspect the patient. First of all, we have to check for the skin for presence of any kind of scar marks, any kind of surgeries, alright, any kind of pigmentation of the skin, if there is any kind of pigmentation, or any kind of stria. Stria are basically the stretch marks. You must have seen the stria. This is very common in the pregnant ladies, especially after the delivery. You can see the birth marks on the abdomen. Those birth marks are called as the stria. Alright, stria are also pathological that can be seen in case of Cushing syndrome. Stria is basically due to the stretching of the skin. Because of the stretching of the skin, the subcutaneous tissue that is present gets separated and therefore leading to the development of the stretch marks. Alright, so in the skin, first of all, you have to observe for any kind of pigmentation, any kind of scar mark, any kind of stria that are present on the skin. Or you can also see for the presence of the blood vessels if they are seen on the abdominal muscle. Then second, you have to check for the umbilicus. Then you have to inspect the umbilicus. You have to check for its location, where the umbilicus is situated, how is it oriented. Alright, if there is any kind of inflammation that is present, you have to check for the contour of the umbilicus, whether it is depressed or it is elevated. So you have to check for the umbilicus, its location, its contour, its inflammation, if any present on the abdomen. During inspection, we are just looking at the patient and we are not touching the patient. Alright. So we have to check for the skin, we have to check for the umbilicus, we have to check for the shape of abdomen. The normal shape of abdomen is slightly boat shape or slightly scaphoid. Alright. This is the shape of the normal abdomen and it can be distended or swollen in certain conditions. If a normal person is coming to us, then the shape of the abdomen will be slight boat shape or slightly scaphoid. Alright. But it can be distended, means this is normal shape, it can be distended in many conditions. The distension can be due to generalized or it can be localized. In case of generalized distension of abdomen, there are 5 F responsible. 5 F are responsible for the general distension of abdomen. Whenever a patient is coming to us and we see distension, then basically 5 F are responsible for the distension. What are these 5 F? Number 1 is fat. If the person is obese, then there will be distension of abdomen. Next is flatus. If there is accumulation of flatus, then the patient can be having distension of abdomen. Feces. If the patient is constipated, then there can be distension of abdomen. Fourth one is fetus. That is, if the lady is pregnant, then the patient can also have distension of abdomen. We have fat, flatus, feces, fetus, and the next one, the last one is the fluid. Due to accumulation of fluid, especially in case of ascites, the patient can have distension of abdomen. We are going to discuss the various tests what are needed to be done in case of distension of abdomen, or if there is any accumulation of fluid in the abdomen. Alright. So these are the 5 F: fat, flatus, fetus and fluid. Alright. Due to which there can be generalized distension of abdomen. Localized distension of abdomen can be due to, number 1, distension of the bladder. If there is accumulation of urine, excessive urine in bladder, then it can be distended, or it can be due to any kind of tumor, any kind of growth, alright, in the abdomen, any kind of swelling that can lead to the localized distension of abdomen. Alright. So we have to check about the skin, we have to check about our umbilicus, we have to check about the shape of the abdomen. Then we have to inspect for any kind of movement. If there is any presence of blood vessels, if there is, we have to check for the skin. Alright, check for the skin pigmentation. We have to see for the umbilicus. We have to check for the shape of the abdomen. Alright, we have understood the shape of the abdomen. What is the different shape of the abdomen? Then we have to see for the peristaltic movements. Okay, if present. Normally, when you observe a patient, then you can feel the peristaltic movement of the intestine, and because of that peristaltic movement, you can see the movement of the abdomen. Alright, so peristaltic movement can be seen from the outside in case of a patient. Okay. Next, we have to inspect for any kind of blood vessels if present. Alright, and last one, we have to check for the presence of any kind of hernias. Hernias and genitalia we have to check for. We have to check for the hernias and genitals. In many conditions, when a patient is coming to you with abdominal complaints, the patient can have hernias, different type of hernias a patient can have. He can have umbilical hernia, he can have abdominal hernia due to the, he can have incisional hernia, he can have inguinal hernia, the patient can have femoral hernia. So there are different types of hernia with which a patient can come to us. So we have to also inspect for the presence of any kind of hernia. What is the basic or the most common method of checking for hernia? Whenever a patient is coming to you and is lying down, then you ask the patient to cough. Whenever the patient is coughing, due to the increased intra-abdominal pressure, there will be protrusion of the hernial site. So you have to check for the hernia as well. So these are the basic points that we have to check while doing the inspection of the patient. So this completes our inspection in abdominal examination. Now we come to the palpation. Okay? Inspection is complete. Now we will start with the palpation. What are the different steps, or how are we going to palpate the patient? Palpation means by touching. We are using our 4 fingers, these 4 fingers, and this palm palpate the patient while doing abdominal examination. Alright, so there are two methods of palpation. Alright, both have to be done. Number one is superficial or light palpation, and the second one is the deep palpation. So we have superficial palpation and we have deep palpation. Superficial palpation is done lightly with the fingers. Alright, we all know that these are the 9 quadrants of abdomen. So 1, 2, 3, 4, 5, 6, 7, 8, 9. So we have to palpate all these 9 quadrants of the abdomen while doing the palpation. First of all, light palpation. Why the light palpation is done? Light palpation is done to check for the following points. There are certain points that we need to check for while doing the light palpation. Number one, we have to check whether is there any kind of pain that is present. We have to check for pain, or it is also known as tenderness. Tenderness is a condition when there is pain on applying pressure. So whenever a patient is coming to us and we are doing light palpation, then we can know that which area is tender, that is which area is painful, so that we cannot start the deep palpation from that particular point. We have to check for the tenderness, then we have to check for the guarding of muscles. What is guarding of muscle? Guarding of muscle is a natural protective phenomenon. Whenever we are going for a palpation or examination of the patient, then there is a contraction. If there is pain in the patient, then he tries to go away from those examining fingers in order to protect himself. So guarding is basically what? This is the protective mechanism of the muscles by which they try to contract when the hand we are going to examine the patient. But this is voluntary process. Alright, first of all, there is involuntary contraction of the muscles, but this can be controlled by our will. If we try to relax these muscles, the muscles will get relaxed. Because in the third phenomenon, that is known as the rigidity. Rigidity is also a protective phenomenon in which there is the muscles try to protect itself. But the rigidity is involuntary. We cannot relax the muscles in case of rigidity. Rigidity is seen in case of generalized peritonitis, where the muscles of the abdomen becomes contracted hard and they cannot be relaxed. So during the palpation, we are checking for the tenderness, for the guarding of the muscles, for the rigidity, and also for the skin condition or the skin turgor. Skin turgor is basically the hydration. Whenever you are applying fingers on the skin of the patient, then what happens is we can feel whether the skin is hydrated or not hydrated. Alright, we can feel the skin is dry or not, it is slight moist, or whether the skin is very much tight in case of distension of abdomen. And so by doing the palpation, we can know about the tenderness of the patient, we can know about the guarding, rigidity, and the skin turgor. Alright, we are doing the palpation in all the 9 regions of the abdomen. First of all, the light palpation is done, and after performing the light palpation or the superficial palpation, we can know that where is the problem in these 9 regions, and after that we can go for the deep palpation. For the deep palpation, we are inserting the fingers more deeply, applying more pressure on the abdomen of the patient. But care has to be taken that never start palpating from the tender areas or the painful areas. Always palpate from the less tender to the more tender areas. Always start from the left inguinal region. Alright, left inguinal region, then you have to check for the palpate the kidneys, left kidneys, you have to check for the left spleen, then you can come on the right side for the right kidneys, then liver and the other organs can be palpated for. You should also feel the abdominal aorta, you should also feel for the bladder and the other organs of the abdomen. So in this way, for doing the deep palpation, there are different methods for palpation of the different organs. Like we have certain method for palpation of the kidney, for the liver. Alright. In general, we are just doing the deep palpation. The exact method of palpation and percussion for the different organs, I am going to take separate lecture for all those organs. But this is just an introductory brief of the abdominal examination, the 4 methods of abdominal examination, that is the inspection, palpation, percussion and auscultation. So we have covered the inspection, we have covered the palpation, we have covered both superficial palpation and the deep palpation. Now we will come to the percussion. We will start with the percussion now. Percussion, I have already told you, we are percussing, we are using this middle finger and these fingers and then tapping on the skin of the patient. While we are tapping, to know the noise or the note of the abdomen, we have to listen to the sound to check for the resonant note or the dull note. Alright, percussion also have to follow the same pattern. By doing the percussion, we can know the different areas. Like if, for example, we are percussing for the liver dullness, then we are doing the examination like this. So we can know the border of the liver. Where the liver is there, we can know the borders, the margins. How we can know the margins? Because over the liver there will be a dull note, and other than the liver there will be a resonant note. So in this way, when we are doing the percussion, we are doing the percussion like this on both the sides, so that we can know about the different areas, the different borders of the organs, the different organs we can know about those areas. Now, what is the significance of percussion? By doing the percussion, we can also know, especially I was talking about the distension of abdomen. So, during the distension of abdomen, there are various percussion notes, especially in case of ascites, that are heard. I just want to discuss about ascites here to make you understand more about percussion. That how is percussion important and how to do that percussion. So, if a patient is coming to us with an abdominal ascites, if there is an ascites in the peritoneum, and due to which there is distension of abdomen, and we are doing percussion, then what kind of test can we do, or what is the significance of percussion in such case? So there are various tests that could be done during the examination in order to assess the ascites. Number 1, we have shifting dullness. What happens in shifting dullness is, patient is lying supine and we are starting to percuss the abdomen from the center towards the lateral sides. Alright, and then we are checking at what point we have a dull note and at what point we have a resonant note. Then we ask the patient to slightly tilt on one side and then we again start to percuss. There will be a shifting in the percussion mode, that is from resonant to dull side or from dull to resonant side. This is known as the shifting dullness, that is seen especially in case of ascites. We also have fluid thrill. What happens in fluid thrill is, the patient is lying in the supine position and we are tapping it from one side and putting the hand on the other, and then we are checking on the other side for the vibrations. So this is another method of doing percussion, and the third one is the Puddle sign. Puddle sign, when the patient is sitting with knees and knee-elbow position, like a dog-like position. A patient is sitting on the knees with the elbows, and due to gravity, the whole of the fluid will be accumulated at the around the umbilicus. And then you are doing the percussion to check for the presence of any kind of fluid. This is known as the Puddle sign. So this is how percussion is very important to assess the border of the organs, to assess the fluid that is present in the body. So this is all about the percussion. So we have understood about the inspection, that how inspection is done, what is the importance of inspection, how the palpation is done, what is the importance of palpation. Third one is the percussion, that how the percussion is done and how we can reach at certain conclusions with the percussion. Now we will come to the last part of today's lecture. We are going to discuss about the auscultation. I have already told you that auscultation is done by using a stethoscope. By using the auscultation, what we are doing is we are listening to various sounds. Alright, so we are applying stethoscope on the abdominal region and then we are listening for the sounds. What are the basic two sounds that are usually heard? Number one is the peristaltic movement. In the normal condition, there is movement in the intestine, due to which the fluid is moving and there is movement, intestinal mobility, due to which there is peristaltic movement and the sound that is produced is known as borborygmi. Alright, so borborygmi is the sound, or say this is plural and borborygmus is the singular. This is the sound that is heard with the stethoscope during the auscultation in case of abdominal examination. So we are checking for the intestinal mobility, especially in case of borborygmus. Okay. And the second one is we are checking for any kind of bruit. What is bruit? Bruit is basically a turbulent sound that is heard when the blood is flowing through the narrow blood vessels. So we are listening for different type of bruits, that is the blood flow. We can hear for bruit in the abdominal aorta. We can listen for the bruit in the liver, in the kidney. So we can listen for the bruit or the bruit in the vessel wall of different places. We can listen for the abdominal aorta, we can listen for the bruit in the liver, for the kidney and other places. So during the process of auscultation, we are checking for the peristaltic movements and for the bruit. In many conditions such as obstruction in intestine, there is, or obstruction in the intestine, there is accumulation of fluid. Alright, so when there is accumulation, severe accumulation of the fluid and the fluid cannot move ahead, then when we shake the patient, then at that time fluid thrill is experienced in the patient. Alright, or this is known as the succussion splash. That is a splashing sound that is heard over the abdomen when the patient is shaken vigorously. So we can also listen for the succussion splash. This is very prominent in case of intestinal obstruction. So these are the various methods. These are basic 4 methods of examination of the patient when a patient is coming to us for the abdominal examination. I just want to give you a quick recap of what we have just discussed. Whenever a patient is coming to us for abdominal examination, we need to perform 4 simple steps. We need to check for the inspection, we need to go for palpation, we need to go for percussion, and we need to go for the auscultation. During the inspection, we have to see for the skin, the presence of any kind of scar marks, any kind of stria, any kind of blood vessels on the skin. We have to check for the presence of umbilicus, its location, its contour, if is there any kind of inflammation. We have to check for the shape of the abdomen. We have to check for the shape of the abdomen. Normal shape of abdomen is the bone shape or slightly scaphoid, but it can be distended in generalized ascites or edema. It can be generalized or localized, but the shape can also be, the scaphoid shape can become more scaphoid in case of severe malnutrition, and there can be variation. rectus muscles can get separated, and this would also change the shape of the abdomen. So we have to check for the shape, we have to check for the movements of the abdomen, if any present, blood vessels, and then we also have to see for the site of hernias. Alright, so different type of hernias and also the genitalia. We also have to check for the genitalia. The examination of genitalia I have not discussed here because we will be taking a separate lecture for the examination of genitalia. Then during the palpation we have to do two types of palpation. Number one is superficial palpation or the light palpation, and then we have to do for the deep palpation. Alright. So superficial palpation we are doing for checking for tenderness, cardiac rigidity and skin turgor, and deep palpation we are doing for examining the different organs of the body like spleen, kidney, liver, alright, and bladder, etc. Percussion we are doing using these fingers, and percussion we have two modes in the abdominal system. We have a resonant mode and we have a dull mode. Resonant mode is especially in the area where air is there, and dull mode where there is fluid or any solid mass that is present in the body. So by doing the percussion we can know about the borders, the margins of the different organs that are present, like liver margin we can know about. We can also know about the various disorders, especially in case of ascites we can know about the shifting dullness, fluid fill, we can also check for the Boodle sign, etc. Then when we come to the auscultation, in the auscultation we are checking for the intestinal movements, and we are listening to the intestinal sound that is known as the borborygmi, and then we are checking for the bruit, different kind of sounds or bruit that is due to the turbulent flow of blood through the blood vessels. So we are checking for the borborygmus and we are checking for the bruit. So in this way the examination of the abdominal system is complete. This is just a superficial examination. We are going to do the deeper examination, the individual organ examination separately in another lecture. Alright, then we will also be doing the examination of the genitalia in a separate lecture. So this was all about the introduction of the abdominal examination. These 4 steps: inspection, palpation, percussion and auscultation, how these are done. And I hope you have understood all these 4 steps, and now you are ready to perform these examinations on the patient, especially this introductory, after this introductory session. So this was all for today. Thank you very much. We will be meeting in the next lecture, in the next class tomorrow. Thank you very much. Namaste.